Hi everyone and welcome to the Learning Ladder, and today I'm doing my 19-week pregnancy update. So I'm currently 19 weeks and 6 days pregnant today. So this week was exciting because I have my anatomy scan. Obviously any ultrasound is always exciting plus nerve-wracking, so I went in there hoping for the best, but I'm pleased to say everything was fantastic. Baby is perfectly on track for everything. So I was there for a good 45 minutes and they check everything. So they check all the organs, they check the legs, the arms, they check the face. They checked, the kidneys and the heart and absolutely everything. And I had to do the whole swishing from side to side a bit to get the baby into the right position because they weren't always in the right position. But thankfully, they did get into the right position so she could do all her measurements. With my daughter, I ended up actually going back for a second time because they couldn't do spine and kidneys. And it's funny because those were the two things that this time as well that they had an issue with, but in terms of the baby being in the right position. But this time the baby did actually move so that they could get the right position, so they could check. But it was amazing. They even showed the blood supply for the kidneys and everything. It was just such a relief to see that everything is fine and good. Baby did not want to have a picture of its face taken again. I don't know what it is. So she said that because I'll have to go back towards the end of the pregnancy for growth scans and things, she said she'll try and get a better picture of the face then. But I was quite happy with the side profile. It was really cute. And if I look back at my daughter's 20-week ultrasound scan, I can't, it's terrible. The picture is, in terms of the picture, the best pictures I ever got was when I went for a private scan. I don't know what it's about the NHS, maybe it's their equipment, I don't know, but the best picture I ever got were with private scan, which was with my daughter when I did the 4D scan. It was amazing. But yeah, the pictures are funny, but they only give you one, but with the NHS here at least, and you can buy extras, but they're of the same picture. So it seems a bit daft to buy extra of the same picture, I guess, if you're wanting to hand them out to people, but obviously you can just photocopy them and stuff, can't you? But yes, it was fantastic. So I'm so relieved that everything is doing so well in there. Baby's great. Everything is going really well. In terms of movement and stuff, they were jiggling away and kicking and everything. It was so funny because I had my arm above my head, kind of like this, because they make you lie as flat as possible. But the screen's in front, so I wanted to be able to see, so I'm like leaning like this so I could actually see. And the baby was doing the exact same thing, leaning like this with its head, arm behind its head. I just thought it was hilarious. It was doing the same thing as me, but anyway. Yes, so very relieved that everything is going well in there. The only thing she did say, and it's very common at this time, is that the placenta is obviously anterior, which we knew, and it goes all the way down the front, but it also is on the lower segment too. She didn't say it was covering anything, she just said it was on the lower segment, but it's very common at this stage, and 90% of placentas move. They don't actually move, if it's just that when your uterus grows, the placenta moves in that way, because obviously if you think of a balloon and you put like a dot of ink at the tip of the balloon where you blow it up, as you blow up the balloon the dot moves. So that's what normally happens. I mean, 90% that happens. Had the exact same thing with my daughter's pregnancy, and again it moved. So fingers crossed, everything crossed, it does actually once my belly gets bigger. And I also think I had my ultrasound quite early. I was only 19 weeks and 2 days pregnant, whereas I think and I'm not particularly, I mean, I have got a bit of a bump, but I don't think I'm particularly large at this stage. I've seen lots of other women at this stage who are much bigger, so I do think there's lots of room to grow yet, which gives me hope that everything will move as it should. If it doesn't, then you have to have a C-section. But if that happens to me, I'm going to get a second opinion to make sure, because I really want to avoid, I don't know, some people seem to have the opinion that, oh, cesarean, it can be elective and everything else, and you can choose to have one and things, but it's still major surgery, and I wouldn't choose to ever have major surgery unless I 100% needed it. So if they think it hasn't moved up quite enough, then I'll definitely be getting a second opinion. So according to my research, it has to be 2 centimetres away from the cervix in order to deliver vaginally. So fingers crossed. So I have to go again at 32 weeks, but I had to go again anyway because of my age. I have to have growth scans later on in pregnancy, but so far everything is perfect. The baby is measuring, they did the leg bone and everything else, it's measuring perfectly with my dates as it should. So fingers crossed, everything is going well in there. In terms of my symptoms, more stretching again this week. Again, I think I'm getting another growth spurt. Also heartburn again. I've just been mindful of, you know, eating sitting up and things, and not, you know, eating like a massive meal at one sitting, you know, trying to even it out a bit so that, you know, I'm having multiple smaller meals than what I would normally do, and that definitely helps. I still haven't taken anything for it. I'm still trying really not to. I don't think it's as bad as it was in my first pregnancy. It could be that, or it could be that I've just got used to it, because even after I gave birth to my daughter, I still kept having heartburn issues for a long time, until I lost the pregnancy weight, and I was diagnosed with acid reflux shortly after she was born, because it hadn't gone. They get offered to give me omeprazole and things like that, but I decided not to take it. So once I started losing the baby weight, I noticed that it went, and as long as I watched, you know, what I ate in terms of not eating, you know, before going to bed and stuff like that, I managed to control it without any medication. But obviously now that I'm putting on weight again with the pregnancy, and obviously normal pregnancy hormones with the baby pushing up on my stomach, I think that's why it's got its resurgence again. But I still don't think it's as bad. Either that, or like I say, I've got my level of tolerance has increased because of having it for so long after pregnancy anyway. But those are my main symptoms. Still stuffy nose. But other than that, nothing really in terms of anything negative. Cravings wise, still loving my cornflakes and milk. That definitely helps with the acid reflux. Fruit still. Had a melon the other day. It was amazing. Still loving obviously the sweet stuff, but I do try to be, you know, not, I wouldn't say I don't stop myself from having them, because I think that can be worse, but I kind of I'm mindful of, well, if I want something sweet, could I have a fruit instead of, you know, a chocolate bar or something like that. I try to limit obviously caffeine and things. But yeah, that's pretty much it in terms of my symptoms. In terms of I didn't know whether to talk about this or not, but I think we will, because I'd love to get your opinion on it, and if you've been in this situation, what you would do. So one of the things that I was advised to take, and again they say it with, you know, it's up to you scenario, but we would highly recommend kind of not using those exact words, but along those lines, is to take aspirin. So it's low dose aspirin that you're supposed to take, and it's basically anyone who's over a certain age. And also if there's different risk factors, and if there's high risk factors, so if you've had preeclampsia before, if you've got gestational diabetes, if you have any kind of autoimmune things, lupus, that kind of thing, they recommend aspirin, low dose daily aspirin when you're pregnant to prevent preeclampsia. And there's also additional risk factors, such as if you're over a certain age, like over 35, over 40, those kind of things. And also if you have had a gap between pregnancies of more than 10 years. I don't know if it's live birth or just pregnancy. I assume when they say pregnancy, they mean live birth, but I don't know for sure. So I fit into two of those risk factors. So over the age of 35 and 10-year interval, obviously slightly bigger than that, between my pregnancies, if we're counting live birth. So that would put me at a moderate risk for preeclampsia, and also growth restrictions, placental issues and things like that. So they've done loads of studies, and some of the studies suggest that if you take low dose aspirin daily during pregnancy, it can help prevent preeclampsia, provided you start taking it before 16 weeks, and it can also help the placenta in terms of blood flow to the baby. However, from my understanding, the study and the recommendation to take it is more on the lines of the preeclampsia than the blood flow to the baby. That's just the way I read it. Maybe I'm wrong, I'm not a doctor, but you know, that's the way I read it, is that the study was mainly done to suggest that it helps reduce preeclampsia. So I was obviously advised to take it. I did tons of research, I read so many different articles, and I decided against it on my personal circumstances. Do not ever take a medical decision based on what someone else says on the internet. Do your own research and look at your own factors, which I know everyone does, but that's just basically the reason why I didn't take it. And there were several reasons why. So the first reason that I decided against taking it was because I've never had preeclampsia before. I've never had any hypertension issues whatsoever. I had a normal healthy pregnancy. I don't have gestational diabetes. There is no diabetes in my family at all, or blood pressure issues. So from a health point of view, in terms of those considerations, that's why one of the reasons why I decided not to take it. I also decided not to take it because, as far as I'm concerned, I don't feel like there's longevity research to show whether or not it impacts babies once they're older. So they did some research from when the baby was born, but there hasn't, as far as I can see, correct me if I'm wrong if you know of any studies, there hasn't been long-term studies to say whether or not it affects neurologically or anything like that. And that's one of the things that makes me nervous about taking it, because as we all know, there's been so many different things that you've been told, oh, it's safe to take this, you know, it's fine to take this, there's no risk taking this, and then it turns out years later, oh, actually, we think maybe you should only take this in certain circumstances. So, for example, if you've had preeclampsia, then obviously you're at a greater risk of getting it again. So maybe in that case, consider it. So that was one of the other reasons. You know, I'm not going to name them, but we all know about medications that people have been prescribed during pregnancy that have resulted in problems. But oftentimes they were immediately after birth, whereas sometimes you might not realise at first, and it could be something that presents itself as the child gets older. And that's kind of the information that I feel like is lacking at this point, because of the fact that it's quite a new thing, I think. I certainly wasn't told to take it. I mean, I wasn't over 35 anyway when I had my daughter, but I was an IVF pregnancy with my daughter, and I wasn't told to take aspirin. And that's another one of the factors that if you have assisted conception, that they recommend you taking it. But the whole thing about assisted conception has changed from when I had my daughter. For example, nowadays they do a lot more checks on you and class you as more high risk just because you've had assisted conception, whereas they didn't then. So I don't know, things change and chop around like the wind. You could say it's because of research, but I don't know, certain things make sense and certain things don't. So anyway, so that's another reason. Now, I also read a study, and again, this is just my opinion and one of my thoughts, and it mentioned that women who took low dose aspirin during pregnancy were at an increased risk of having additional blood loss or hemorrhage at the time of birth. Now, why that raises alarm bells with me is because of the fact that I definitely had anemia during my pregnancy with my daughter. And when you're anemic anyway, you're at more risk of having blood loss after pregnancy. And if I get anemia again during this pregnancy, then and I was taking aspirin as well, then surely that would make my risk of blood loss even worse. So that's another thing that makes me concerned about taking it. And then also my gastro issues with the acid reflux. So aspirin is known to irritate the gastric mucosa of your body anyway, and obviously the fact that I do have acid reflux, but I also am pregnant and getting pregnancy heartburn, taking the aspirin might make it 10 times worse, which can impact your sleep. If you're having you know, really bad acid, it can impact your sleep, it can impact your eating, and sleep and food are really important during pregnancy. So that's another reason why I decided against taking it. So with all that being said, did I make a mistake? I won't know at this point. All I know is that my anatomy scan was perfectly normal, everything was fine in there, baby was growing well, so there isn't obviously any growth restrictions. I've been monitoring my blood pressure at home weekly, perfectly fine. I've also been doing my urinalysis every week, again, no protein so far. So from a preeclampsia and also from a growth restriction risk, so far, touch wood, I'm doing fine. But like with everything, with any kind of medication, there's always risks and benefit analysis. And from my opinion at this point in time, the risk and benefit analysis wasn't strong enough for me to take it. Now, the only problem is with the aspirin is if you don't start it before 16 weeks, it's kind of a bit too late, because of the fact that it's a preventative rather than it doesn't really do, as far as I'm aware, it doesn't really do much if you already got those symptoms. But the fact that my anatomy scan was normal, and again, I haven't had any blood pressure issues so far, then to me, I'm now 20 weeks, then hopefully that means that things are going well, and also the placenta is developed now. So it's one of those, there's always risks and benefits with everything you do, and ultimately you can get all the advice you want, but you've got to live with the consequences of your actions and your decisions, and they can recommend whatever they feel like is appropriate, but ultimately you have to live with the consequences if you take it or if you don't. So that's kind of like where I've gone with it. Whether or not it was the right decision, we'll just have to wait and see. But That was something that I had a conversation with. The whole reason I bring that up is because I had a conversation with the midwife, a midwife, about it today, and I thought I'd mention it in case you are taking it, because I'd love to hear, you know, why you decided to take it, and also if your doctor recommended it as well. As far as I can see, it's a blanket recommendation now. It seems to be a lot of people are getting it recommended to them, and it seems to be on the basis of, well, it can't hurt, and I don't know whether that's entirely true, and I guess we'll never know until years in time when they've got much more evidence to say whether or not that's true. But there are definitely 100% women who should take it, you know, given their history. And then I think I was in the grey area. Like, yes, it might be beneficial, but it also might not be that useful. And because of the risks to my health, my personal health, with the gastric issues, and aspirin is known to cause ulcers and all kinds of things, and then also my concern of the risk to the baby, those are the main reasons why I didn't take it. Yes, anyway, that's everything for this video. I'll do a bump shot in the I'll do my book, because I don't think you'll be able to see it if I stand up now. I'll do a bump shot in the picture, and I'll see you in our next video. So I'll be 20 weeks. Well, I already am 20 weeks. Well, 20 weeks tomorrow. And to think I'm halfway there, it's like, wow, it's gone so fast. Please let me know if you've had a second pregnancy. Did it just fly by? Because it literally has felt like it's flown by. I'm currently working on sorting all the rooms out, so I had to move all this room around so that I can fit the bassinet in, so I've already done that. I'm trying to get everything big done before I get too big. And the next thing this weekend I'm starting to work on is the nursery, so I've already got paint, but I need to clear the room, decide what to do with the wallpaper, strip it or just paint over it. I know you're not supposed to do that, but I'm kind of leaning towards that because I think that'd be easier, but you know. And my thought process is that they might want to redecorate it when they're a bit older anyway, in which case I'll just have to do it again anyway, so you know, I don't know. But yes, I'm just thinking of painting over it now. I'm going to do a test little section and see how it looks, just painting over the wallpaper rather than stripping it. My fear is if I strip it, what's it going to be like underneath? But I think it shouldn't be too bad, because I think the house was rebuilt, although it's an older stone house, it was rebuilt, so I do think, not recently, but you know, within the last century, so I do think that it shouldn't be too bad, the walls, but I don't know, I'm scared in case the plaster starts coming off, and I don't want to go through the whole thing of having to get someone to plaster it, so I'm thinking just paint over the paper. But anyway, yeah, the exciting thing is starting in the nursery, and then everything has pretty much arrived that I ordered now, so I'll do a big haul soon. I just want to get the nursery done first, because that's my focus. I need to concentrate on that, because like I say, I want to get it all done before I get really big, and then I can, and obviously a lot of it's in boxes still. I haven't opened it. I've just had a peek inside, but I haven't opened it. My cat is meowing constantly because she wants to come in. Yeah, so once I've got everything in the nursery and unboxed it and stuff, then I'll definitely do a haul and show you all the big items, and that's it. So I'll see you in the next video. Take care, bye for now.